ear ringing, and there are different causes, but it's usually either have hearing loss or they just suddenly develop that. And what's your suggestion about ear ringing?
Yeah, so it's a very interesting topic. There was a study done in 2014 out of Italy that was done on patients with Meniere's disease, which is a kind of rare diagnosis of exclusion that has to do with ringing in the ears, unsteady gait or imbalance, and spontaneous or positional types of vertigo, which is the room spinning around you. And people in that study took an herb called Pycnogenol, which is a special type of pine bark, and they found that this herb increased blood flow to the inner ear, and it had a statistically significant improvement after 3 months and after even 6 months more of an improvement on ringing in the ears and symptoms of vertigo, fullness in the ear, different things with features of Meniere's disease, which is interesting.
So what is the name of that herb?
It's called Pycnogenol.
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 Okay.
Yeah, so pine bark is it's a type of pine bark, I believe, grown in a specific area of France.
So usually it's a tablet or capsule, or what kind of form?
Usually it's a capsule, but interestingly the capsules sold online and the supplements are a slightly lower dose than the one used in the actual trial. So it depends on the patient, and their weight, probably their other comorbidities, if they have any renal or liver disease or other issues, and then medication interactions, of course, you have to be considerate of that, whether someone's a candidate for it or not, and what their dosing should be. So there's not really clear guidance on that, but there is some evidence that it may help some patients if they're, appropriate candidates for it.
So if patients take that for 3 months, they have reduced ear ringing, and they should continue to take until the ringing disappear, or if we control to a certain level and then they will stop. What's your suggestion?
Yeah, so I don't know 100% if the ringing will disappear. When I've used it in clinic, I've seen mixed results. So for some people, it has helped reduce the ringing in the ears, whether that was caused by a medication side effect or just with age or other issues. But in other patients, it hasn't really been effective after even 6 months of taking it. So it really varies on a case-by-case basis. I think it's generally safe to try, but again, you have to, consider someone's other medications, potential interactions, and their labs and where the patient stands.
So the mechanism, is that reduce the inflammation in the inner ear, or it will just like generally the medication will numb the nerves?
So the mechanism that they think is potentially just they're stimulating increased blood flow to the inner ear. And who knows if that brings in more, healing elements, from the body to the inner ear to kind of help. I can only speculate because, we only know a little bit, but I think there are new medications like pharmaceuticals actually coming on the market in the near future too to treat ear ringing. We'll have to see whether they're effective or not because the clinical trials are still ongoing.
Yes.
But I know it's a very large concern.
Yeah, I think if it increase the blood flow to the inner ear, then it helps reduce the inflammation because there is inflammatory chemicals there. If you speed up the circulation, then you can clear up that inflammatory chemicals. And not only that, and the peripheral nerves, even the nerves in the brain can regenerate once the inflammation goes down. So I think if I can combine, give the suggestion, they can try themselves. And can you repeat the name again?
Yeah, it's called Pycnogenol, Pycnogenol. And again, people have to look at, their labs and their other comorbidities and medications to make sure there's no interactions,
Yeah. So always start at the lowest possible dosage and gradually increase, right?
Yeah, exactly. And it's hard to measure inflammation in the inner ear. I don't think we have a really accurate way of doing that. So it's more just seeing if this helps patients who are candidates for it over time.
Yes. So any kind of disease, I was thinking about that, is one is blood circulation and one is inflammation. So if we can reduce the inflammation, enhance the blood circulation, then you can improve any kind of symptoms if they are willing to try change their food, their lifestyle, right?
Yeah, I think it can. Again, I've seen mixed results. So I've seen it help some people, and then other people I've seen try it for 6 months and it didn't have much of an effect. But again, it's also possible that we didn't have the person take high enough of a dose.
Yes.
Because maybe they only started with a lower dose and they didn't titrate up to enough of a dose that they needed compared to the other patients.
So one more question that, see, like I use Chinese herbs, I put different herbs in a formula, but I never ask people to take that forever, like drugs. You take that for years and years. I usually, like if I target allergies, and then I'll ask them to change, avoid all the histamine release food and avoid high stress, and then I give the herbs, and I usually let them take 3 to 6 months. Up to 1 year. If it's working, then stop. If the symptoms goes away, just stop taking that. And then when the symptom comes back, you resume. And that way, the receptors will be resensitized when you stop. Even the herbs, if you take for years and years, then your body, the liver will produce enzyme to destroy the herbs. When you take that too long, and it probably have other side effects.
Well, your body becomes resistant
Yes.
to different things over time because the receptors, change and they can be more resistant to the effects.
Exactly.
So it's not as effective, but then you still get potential metabolites that can be taxing on the body over time if you take it for a long period of
Yes.
time. So it really depends. And there's also, ear issues can be caused by viruses too.
Yes.
So if it's caused by a virus, then it could be something that's transient or temporary, where you may only need to take something for a short period of time. Sometimes
Yes.
we can treat that like if it's in a case of vestibular neuritis with steroids, which suppress the immune system activity overall, and that can be pretty effective in some cases.
Thank you.